we all know that this month we celebrate or bring awareness to breast cancer, celebrate the survivors of breast cancer, and I thought that I would do just that, celebrate all the people who are fighting currently, all the people who have won the battle against breast cancer, all the people who fought for so long, and just celebrate how far we've come in science and medicine into improving our chances of defeating breast cancer. So, cancer is a pretty depressing thing, and no one wants to get cancer, but science has really come a long way in terms of prevention and treatment, and it's easy to look at the negative statistics, but I am choosing not to do that today and to look at the statistics from a positive perspective. So, did you know that if breast cancer is diagnosed at stage 1, then there's actually as high as a 97% chance of surviving for 5 years and counting, which is really amazing. But maybe most people or some people don't catch the cancer at stage 1. Well, on average, you actually have an 85% approximately chance of that 5-year survival and counting, even if it's not caught at stage 1 on average. But of course, the earlier you catch it, the better. A 10-year survival, 75% chance. So breast cancer is actually a cancer that we are doing so well at trying to defeat. Now, unfortunately, some people, still die from it, and it's a really hard fight. So shout out to all those fighters and survivors out there. So what does it mean to catch it at stage 1? Well, stage 1 means that the cancer is really small and that it's confined to the breast. It didn't spread to the skin, it didn't spread to the lymph nodes, it didn't spread anywhere in the body. It's a small cancer that's confined to the breast. If we catch it at that point, we have a super good chance of eliminating it and survival. So that's what we really want to aim for. Now, just to put this in perspective, from the 1970s till the 2000s, we have increased our chances of survival by 34%. So we are 34% more likely now to survive breast cancer than we would have if it was back in the 1970s, and that's super awesome. So how can we take advantage of this 34% higher chance? How can we make sure we maximize our chances? Well, the answer to that is to catch it early, right? There's not a lot you can do to prevent yourself from getting breast cancer. A lot of it is genetic or familial, depending on your family line. So you can't change your genes. You can't predict a mutation in your genes either. So there's not a lot you can do on that front. What you can do though, things that can help, exercise, because obesity increases your chances, and of course good reproductive habits. Those are things that you could help. So things like pregnancy before age 30, not being on the oral contraceptive pill for too long. Those are things that can actually help your chances. Of course, you can't always do that in life, so what do? Screen. Mammograms, ultrasounds, these are the hallmarks of screening. Now, every country has their own screening guidelines, but you need to follow whatever is in your country. But good general guidelines, from the ages of 40 to 50, you really want to start getting your mammograms. Some countries will say annually, some countries will say every 3 years. If you have a risk, like your family had breast cancer, or you have a known high-risk mutation, then your screening needs to start earlier, even in your 20s, sometimes even in puberty, depending on the kind of mutation you have. So you need to follow whatever guidelines suited to your population, but the most important thing is screening. That's how we maximize our chances. Okay? That's all for now, guys.